been excellent to actually see people face to face. VA is really good about networking, and it's hard to do that by teams.
There's not been an opportunity for facility directors to network in quite a while. It's certainly good to talk to your counterparts and talk about issues you're having and get creative solutions that maybe they've come up with to deal with the same issues, or share your own.
Knowing this is the first senior leader conference they've had in 6 or 7 years, I felt it was important to get together with the other senior leaders in the VA, the other medical center directors, network leadership, and central office leadership to talk about important topics, to network, to see each other again, and be able to discuss what's important for the VA, the veterans, and moving us forward.
The most important thing we can do while we are here together in these 3 days is learn from each other.
The ability to connect together, to be in the same space, and to leverage off of the energy is just amazing. People can do so much more together, and the several years we lost to COVID have deprived us of some of those relationships. So I'm getting to meet people for the first time in years, even though I've talked to them for a while, or meet people I'd never heard of, and it's just really cool to be able to connect so we can work together to improve the care and access we provide for our veterans.
I think because of everybody's here in person, it's a big step toward getting back to normal. And so that feels good because it nurtures and strengthens professional relationships across the enterprise.
I know you're not here for the big bucks. I know you're not here for any other reason than making things better for veterans across the country.
Hearing like from the secretary, the undersecretary, the direction that the VA is going in, what the priorities are for them. So when I go back to the facility, I can align my strategic priorities and the business will align theirs, and we're all moving in the same direction towards a common purpose.
By definition, you are a leader with influence in this system. You can move this system in a better place on behalf of vets.
He told us to give more care, more benefits to more veterans.
But the real solutions are coming from all of you. The promising practices, the best practices that you're going to share this week through the facilitated sessions, all of that is gold. That will help us get better in more ways than I ever could directly or any of the leaders in Washington could.
I think the topics have been great. They've been important. They've been the main focus of the VA. Obviously, the Secretary's presentation was fantastic. And just hearing from all the leadership of the VA, and again, meeting and talking to the other facility directors, network directors, really a shared focus, shared vision of what we're trying to accomplish.
So here we are today at another historic inflection point. And America needs the extraordinarily capable leadership of everyone in this room again.
Hearing some of our senior leaders, like the Secretary and the Undersecretary of the different administrations, is also inspirational.
You've onboarded over 38,000 new people this year, on our way to the goal of 52,000. In fact, this is the most VHA has ever hired in the first 8 months of a fiscal year.
The secretary was fabulous when he kept us focused on 3 areas: access, quality, veteran experience, as well as taking care of all of our employees.
Make sure that your providers know, that your teammates know what I know, and what I have no doubt about, that they are the best workforce in the federal government, with the best mission of any organization in this country. Inspire them, just like you inspire me every day.
Listening to the Veteran Service Organization leaders speak was very inspirational. Their knowledge of what we do, their dedication to improving the lot of veterans, and collaborating with the VA was just really inspirational.
When a lot of debates were happening about privatization versus VA-provided care, exclusively VA-provided care, the VFW took a bit of a different tack based on what we received from our members. And it's not a binary choice. Presenting it as that binary choice fails to understand how Americans consume healthcare. There is no system where care is coordinated at the level to which VA commits to coordinate that care.
I think we hear from our veterans all the time, and that's really what's important to us, is to keep our ear to the ground. And I was really inspired by the veteran panel that we had this week.
I was only 3 of the women combat medics. I was a team leader evac, leader with an infantry battalion out of Baghdad, Iraq. When I came back, I did have some breakdowns. I was diagnosed with post-traumatic stress. And I was told by a captain, a psychologist in the Army, who said, don't worry, the VA is going to take care of you. And I didn't know at that time, I was in 2005, what the VA was. Had no clue.
To have veterans take the time out of their personal schedules to share with us their experience, and not only the things that are working well, but the things that are still pain points that we need to improve on, I found that to be incredibly invaluable and something I always want to make sure that I'm paying attention to, my team is paying attention to, and I'm sure the group of SES leaders here found it important as well.
I myself am a Vietnam veteran. I was an infantry medic in Vietnam. Heavily exposed to Agent Orange, and then of course we have the veterans coming back from Iraq and Afghanistan, and thank goodness for the PACT Act. But we look at it this way, those of us that are in the veteran support community, the Department of Veterans Affairs and the veteran health care facilities are not something that belong to the government or belong to a federal agency. This is our VA.
I was really inspired by our veterans panel.
And so we started talking, and I told him I was, the Vietnam era and da. And he says, well, you need to take part of these services yourself at the VA. And I'm like, no, not hardly, because I've heard all these horrible stories. Well, long story short, some 40-some years later, I sign up, and who would have thunk that I would need the services of the VA? I've been in ICU 3 times. I was in a very serious car accident that they were saying that, well, you should forget those stilettos because you're not going to wear those anymore. But you notice I walked up here on my own volition. That's the VA.
The fact that we took care of her in her time of need really shows why the VA does what it does.
A lot of the content is very inspiring. We heard from key program officials. We heard from a VSO panel, VBA, NCA, go through a number of topics. And I think the theme that I walk away from with is synergy and integration.
Largely the greatest asset that VA has going for it is its coordination of care.
The inspirational moment was really about the stories of our veterans, the stories from everyone who shared about how they care for our veterans. What I was most moved by are the possibilities, what's to come, our future, and we'll be providing great care to our veterans. It was an honor to be here.
Improving our work is our work, so this week is a reminder for all of us that there's lots of resources in the VA, and the key takeaway is that we can continue to do bigger and better things for our veterans in support of our mission, and it's a mission that we all take great pride in.